Block 1, MCFT-002, Mental Health and Disorders, Introduction to Health and Disorders. MCFT-002, Mental Health and Disorders. The course on mental health and disorders is the second course in the MSc CFT PGD-CFT program of study at IGNOU. This course will orient you towards mental health, various mental disorders, and the mental health services provided by the Government of India. We will also discuss various disabilities in detail. It comprises both theory and supervised practicum components. The theory paper on this is MCFT-002, and the supervised practicum is MCFT-002. You must complete and clear both these components separately. For the theory paper MCFT-002, you will have continuous evaluation through an assignment and a term-end examination. For MCFT-002, you must work under the supervision of the academic counselor assigned from the study center you are attached to. In the end, as per the details given in the Supervised Practicum Manual, Block 5, you must submit your file to the study center for evaluation. The course also provides comprehensive knowledge on persons with disabilities. It provides knowledge and understanding of various mental health disorders, personality disorders, depression, etc. The course would help you develop the understanding required for counselors and family therapists to have deeper knowledge about the client's mental health and disabilities. The course consists of 4 theory blocks and 1 manual for supervised practicum. The blocks. Block 1 is on Introduction to Health and Disorders. This block provides you in-depth knowledge and understanding of physical and mental health and disorders. The block focuses on the classification and assessment of mental disorders, nosological systems, and positive mental health. It emphasizes the dimensions of psychosocial stress and coping styles. We will also discuss the nature and types of chronic physical illnesses and the mental health perspective in chronic physical illness. Furthermore, we will study the national mental health programs of the Government of India. On studying this block, you will be able to define physical and mental health, classify and assess various mental disorders, and understand the nature and types of chronic physical illnesses. Block 2 is titled Mental Disorders I. This block consists of 4 units. The units explain different types of mental disorders, including mood disorders, cognitive disorders, etc. This block helps you understand the epidemiology, classification, and causes of these mental disorders. It also makes you aware of the diagnosis and etiology of these mental disorders. The block further imparts knowledge about substance use disorders. After going through this block, you will be able to understand the characteristics, causes, and diagnosis of various mental disorders and substance use disorders. Block 3 is on Mental Disorders 2 and consists of 4 units. It continues to discuss various types of mental disorders in detail. The block deals with other mental disorders like neurotic disorders, personality disorders, depression, grief, and suicide. It further discusses the developmental, behavioral, and emotional disorders of childhood and adolescence. The block emphasizes the classification, causes, and epidemiology of these mental disorders. After studying this block, you will be able to understand the cause, classification, epidemiology, assessment, and management of mental disorders like neurotic disorders, personality disorders, depression, grief, suicide, and developmental, behavioral, and emotional disorders of childhood and adolescence. Block 4 is on persons with disabilities. It consists of 5 units. The block orients you towards disability, its possible causes, and its preventive and remedial measures. It provides detailed knowledge on various disabilities, such as sensory disability, locomotor disability, and multiple disabilities, etc. The block also helps you understand mental illness and mental retardation. After going through this block, you will be able to understand the various causes, characteristics, and rehabilitation for different types of disabilities. The Supervised Practicum Manual, Block 5. This block will provide you with the framework for hands-on experience. The supervised practicum has been planned with the implementation of the theory blocks studied in course MCFT-002. As part of practical work, you need to carry out case studies of persons suffering from mental disorders in central institutes or special schools. You must use some structured instruments. The practical manual provides you with step-by-step directions for conducting the practical activities and recording observations. Audio and video programs. Various audio and video programs have been prepared on different aspects of mental health and disorders in counseling and family therapy. These will be available at your study center. It is advisable to keep in touch with the coordinator of your study center to know about new audio and video programs. You must go through these audio and video programs. How will this course help you? The course will provide you with knowledge about mental health and disorders and help you understand persons with disabilities. You will be able to identify various types of mental disorders. You can understand the causes, epidemiology, and etiology of different types of mental disorders. This course will also help you understand the various causes of disability and the preventive and remedial measures for disability. Block 1. Introduction to Health and Disorders. Block 1. Introduction to Health and Disorders acquaints you with the knowledge of the classification and assessment of mental disorders and understanding psychological stress and coping. The block will help you understand the nature and types of chronic physical illnesses and the mental health perspective in chronic physical illness. It will also make you aware of the National Mental Health Program. Unit 1, entitled Notions of Mental Health and Disorders, defines mental health and the reasons for studying mental health. The unit also describes various models of mental health. Further, it defines mental disorders and describes various approaches to the classification of mental disorders. The unit also defines normality and describes multiple models of normality, which focus on different facets of functioning that constitute normality. The latter part of the unit deals with positive mental health, explaining various dimensions, including positive psychological functioning and positive social well-being. Various models of positive mental health are explained at the end of this unit. This unit will help you understand mental health, mental disorders, normality, and positive mental health. Unit 2 is Dimensions of Psychological Stress and Coping. The focus of this unit is on stress. It begins with the definition of stress and its historical aspects. The unit describes various theories of stress, such as the biomedical perspective, psychological perspective, and sociological perspective. Emotional and cognitive models are discussed in detail, including newer models of stress. Stress can be classified in a number of ways. The unit describes various types of stress based on the nature of stress, severity of stress, temporal relation of stress response with the stressor, and duration of stress. Further, the unit describes the effect of stress on physical and mental health. At the end of this unit, you will study how to manage stress through various interventions. This unit will help you understand stress, its types, and various coping styles. Unit 3 is Classification and Assessment of Mental Disorders. This unit has 2 parts. The first part deals with the classification of mental disorders, which includes the utility of classification and various challenges of classification and diagnosis. The history of classification systems and contemporary classificatory systems are also discussed. Further, various categories of mental disorders under ICD-10 are explained, including other aspects of classifications. The latter part of the unit deals with the assessment of mental disorders. In this part, the requirement of assessment is emphasized, and the steps to carry out assessment are discussed in detail. This unit will help you attain knowledge regarding the classification and assessment of mental disorders. Unit 4 is on Nature and Types of Chronic Physical Illnesses. The association between chronic physical illness and mental illness is described at the beginning of this unit. The middle part of the unit discusses some common and major chronic physical illnesses, along with the psychiatric disorders associated with these diseases, such as heart disease, renal disease, endocrine and metabolic disorders, oncological disorders, and skin diseases, etc. The latter part of this unit covers psychosocial treatments, including psychotherapy and behavioral techniques. This unit will help you study the nature and types of chronic physical illnesses. Unit 5 is on Mental Health Perspective in Chronic Physical Illness. The unit begins with the definition and understanding of chronic physical illness. It explains the psychological response to illness and includes a discussion on subjective variables that can influence an individual's response to a given illness, such as personality type, coping styles, and defense mechanisms. The middle part of the unit addresses psychosocial adaptation to chronic illness, including an understanding of basic concepts of psychosocial adaptation. Emotional responses to illness like anger, anxiety, fear, sadness, guilt, and shame are discussed, along with descriptions of adaptive and maladaptive behavioral responses. The latter part of the unit explains the consequences of chronic illness, such as stigma, disability, social isolation, family burden, etc. The role of caregivers is also mentioned at the end of this unit. After studying this unit, you will be able to understand chronic physical illness from a mental health perspective. Unit 6 is on National Mental Health Program. The unit begins with a discussion on various types of mental disorders. Further, it explains the National Mental Health Program, NMHP, including its main strategies during the 10th five-year plan, and the status of NMHP at the end of the 10th five-year plan. The unit also makes you aware of the National Mental Health Program during the 11th five-year plan, including an understanding of the District Mental Health Program, DMHP, and various associated activities, such as mental health services, training, and IEC activities. Manpower development schemes in mental health are discussed at the end of this unit. This unit will help you understand the objectives and status of the National Mental Health Program during the 10th and 11th five-year plans.